Hello everyone, my name is INTAN WAHIDDIN, PM 241100080, and I am a medical student at University Malaysia Sabah. Today, I am going to talk about the field of medicine that I am interested in, which is an anesthesiologist and the disease that is related to it.
This is the content that I will talk about in this presentation.
So, what is anesthesia and anesthesiologist? So, anesthesia is a medical procedure that uses drugs or other substances to prevent or reduce pain and awareness during medical procedures. An anesthesiologist is a highly trained medical professional who specializes in the safe administration of anesthesia, the management of pain, and the care of critically ill patients. They are essential members of the medical team, working closely with surgeons, nurses, and other healthcare professionals to ensure the best possible outcomes for patients undergoing surgeries, medical procedures, or in need of pain management or critical care. So, what are the roles and responsibilities of an anesthesiologist? So, there are a lot of roles and responsibilities of the anesthesiologist. Firstly, for pain relief in surgery. Before an operation, a patient will meet the anesthesiologist for an evaluation. The anesthesiologist will make a plan for the operation that takes into account to the individual needs of the patient. On the day of the operation, the anesthesiologist supervises the administration of medication so that the patient will not experience pain. The type of pain relief offered during surgery may be general anesthesia. The patient goes to sleep while the operation lasts. Sedation, intravenous drugs calm the patient or make them unaware of the procedure. Regional anesthesia, local anesthetic is injected near the nerves to numb the area that will be operated on. This may be the nerve blocks or spinal or epidural injections. They monitor the patient's bodily functions, assess the best way to treat the vital organs, and provide a balance of medications to the individual's needs. Next is after surgery. After the procedure, the anesthesiologist continues to responsible for the patient's overall care. They will reverse the effects of the anesthesia and continue to evaluate the patient and keep them comfortable as they recover. During this process, the anesthesiologist will direct other health workers, including specialized nurses. Lastly, for critical and emergency care of the other roles, the anesthesiologist also plays a key role in critical care and treatment and trauma. They assess patients, make diagnosis, provide support for breathing and circulation, and help to ensure the infection is prevented. Anesthesiologists are also qualified to contribute to emergency medicine, providing airway and cardiac resuscitation, and support and advance the life support, as well as pain control. Some anesthesiologists will seek additional training and qualification to specialize in pain medicine and critical care. There are three systems that are related to anesthesia. First is the nervous system. The nervous system is divided into two, which are the central nervous system and peripheral nervous system. The central nervous system consists of brain and spinal cord. There are neurons, which is cells in the brain and nervous system that send and receive electrical and chemical signals, transmitting information to other neurons, muscles, and tissues throughout the body. There are three main types of neurons. First is the motor neurons. They transmit impulses from the spinal cord to muscles, controlling voluntary muscle activity like walking and talking. Secondly, sensory neurons, which transmit impulses from sensory receptors in the skin or internal organs to the central nervous system. Lastly, interneurons, which connect motor neurons to other motor neurons and sensory neurons to other sensory neurons. So how is the nervous system related to anesthesia? Anesthesia primarily affects the nervous system by altering how nerve signals are transmitted. General anesthetics enhance inhibitory neurotransmitters like GABA and block secretory signals like glutamate, suppressing brain activity to induce unconsciousness and pain relief. Local anesthetics work by blocking sodium channel in peripheral nerves, stopping signal transmission and causing numbness. Regional anesthesia blocks nerve impulses in larger areas by targeting major nerve groups or the spinal cord. These effects are temporary and carefully managed to ensure safety during surgery.
This can impact on nervous system function, which is sensory blockade, interrupts the transmission of pain signals, motor blockade, temporarily paralyze muscle in targeted areas. Autonomic nervous system can suppress autonomic reflexes, such as blood pressure regulation during surgery.
Next is cardiovascular system. Cardiovascular system is to deliver oxygenated blood to cells and tissues, and to return venous blood to the lungs for gaseous exchange. This system involves heart and blood vessels.
Blood carries oxygen, nutrients, and hormones to the tissues of the body and carries waste products such as carbon dioxide away from the tissues. Blood vessels can be separated into three groups: arteries, veins, and capillaries. Arteries carry blood away from the heart. Veins carry blood towards the heart, and capillaries are microscopic thin-walled blood vessels that form a vast network connecting arteries and veins.
Cardiovascular system consists of pulmonary circulation and systemic circulation. Pulmonary circulation moves blood between the heart and the lungs. It transports deoxygenated blood to the lungs to absorb oxygen and release carbon dioxide. The oxygenated blood then flows back to the heart. Systemic circulation moves blood between the heart and the rest of the body. It sends oxygenated blood out to the cell and returns the oxygenated blood to the heart. Anesthesia affects the cardiovascular system by altering heart function and blood vessels tone. General anesthetics can reduce heart muscle contraction and relax blood vessels, leading to lower blood pressure and cardiac output. Some agents also affect the heart's electrical activity, potentially causing arrhythmias. Regional anesthesia can block sympathetic nerves, causing further blood pressure drops and, in some cases, a slower heart rate. These effects are carefully monitored, and medications or fluids are used to maintain cardiovascular stability during surgery. Next is the respiratory system, which made up of the lungs, airways, which is a trachea, bronchi, and bronchioles, diaphragm, larynx, pharynx, nose, and mouth. The main function of the respiratory system is to pull in oxygen for the body cells and to get rid of carbon dioxide, a waste product.
It is separated into the upper and lower respiratory tracts. Air enters the upper respiratory tract through the mouth or nose and nasal cavity where it is filtered. Next, it passes into the pharynx and larynx, which is known as the voice box. From here, the air passes down into the trachea. The inner membrane of the trachea is covered in tiny hair cells called cilia, which catch particles of dust that are removed through coughing. The trachea is surrounded by 15 to 20 C-shaped rings of cartilage at the front and side, which help protect it and keep it open. The trachea divides into two smaller tubes called bronchioles. Once inside the lung, the bronchi split in several ways, forming tertiary bronchi. These continue to divide, forming bronchioles, which are narrow tubes less than 1 mm in diameter. Eventually, air enters alveolar sacs and alveoli, where gaseous exchange takes place.
Anesthesia affects the respiratory system by suppressing the brain's drive to breathe, causing slower breathing. Muscle relaxation can lead to airway obstruction, requiring intubation or a mask to maintain airflow. It also impacts gas exchange, sometimes causing low oxygen levels or lung collapse. Pre-surgery assessments help identify risks, especially in patients with lung condition or smoking history. During surgery, careful monitoring and oxygen support are essential to ensure the respiratory system functions safely and effectively. Anesthesia involves biochemical processes that affect the nervous, cardiovascular, and respiratory system. In the nervous system, general anesthetic enhance the inhibitory neurotransmitters like GABA and block excitatory signals at NMDA receptors, reducing brain activities to reduce unconsciousness and pain relief. Local anesthetics block sodium channels, stopping nerve signals and causing numbness. In the cardiovascular system, anesthetics influence calcium and ion channels, reducing heart muscle contraction and relaxing blood vessels. This lowers blood pressure and cardiac output. In the respiratory system, anesthesia suppresses the brainstem's respiratory centers, reducing the drive to breathe. It also relaxes airway muscles, increasing the need for airway management or mechanical ventilation. These processes can impair gas exchange, sometimes leading to low oxygen levels. Disease that is related to anesthesia is local anesthetic toxicity. Local anesthetic toxicity is a life-threatening complication that can occur when local anesthetics are administered incorrectly or in excessive amounts. The causes of this disease are overdose, which is administering a dose of local anesthetic higher than recommended. Next, rapid absorption, which is high vascularity or inadvertent injection into a blood vessel. The symptoms in neurological effects are numbness, dizziness, and nausea. In cardiovascular effects, hypotension, arrhythmias, and cardiac arrest. Next is the treatment of local anesthetic toxicity, which is airway support by ensuring adequate oxygenation and ventilation. Second, seizure management, which administers anticonvulsants. And lastly, cardiac support. In cases of severe cardiovascular toxicity, lipid emulsion therapy can be used to bind and remove toxic drugs. In conclusion, my interest in anesthesiology stems from its critical role in patient care, requiring a deep understanding of both physiology and diseases that impact perioperative management. Studying conditions like cardiovascular and respiratory disorders has shown me how integral anesthesiologists are in ensuring safe and effective outcomes during surgery. That's all from me. Thank you.